Stirrup Sisters Podcast. I am Nurse Jessie, and I just would like to give our disclaimer. Stirrup Sisters Podcast, we have conversations. Myself, I am a professional registered nurse, Nurse Kristy as well, but Nurse Kristy will introduce herself. We have conversations around women's health, especially women's sexuality or women's sexual health, and we are delighted to have Dr. Litner. However, I would just like to give a disclaimer that yes, we have conversations, we have experts on our podcast. If there is any concern that you may have, please consult with your provider. I'm just going to leave it there. Nurse Kristy, take it away.
Perfect. Well, thank you. I think you said it perfectly. This is not the show to get specialized medical advice. Always go and speak to your licensed medical provider. But I am Nurse Kristy, licensed registered nurse as well. I am super excited to have Dr. Litner with us. Dr. Jennifer Litner is out of Chicago from Embrace Wellness. And first and foremost, can we just say and give it up for a boss in the house, CEO and founder of Embrace Wellness, which specializes in sexual health and has certified sexologist as well, in which Dr. Litner is. Sexual Embrace, or Embrace Wellness rather, has been featured in Cosmopolitan, USA Today, Kinkley, Self Magazine. I can go on, but I won't. I'll pause and just say we are super thrilled. For those of you all who are not familiar with @Embrace Wellness, please go and follow like right now. But Dr. Litner has over a decade of experience in sexual health. And we certainly have a lot of things to unpack, given that it's at the end of the year. People have a lot of goals, Dr. Litner, for the new year. Some might actually be their sexual health. I don't know. We'll see. Hopefully we'll get some questions in the comments.
Hopefully.
But I'm going to pause and have you share with everyone watching and listening, how did you get into sexual health? Like what was the impetus for that?
Absolutely. And Kristy and Jessie, thank you so much for having me on, and thanks to everyone who's going to be listening. I'm excited to dive in. I got into this field through the public health field. So a lot of sexuality providers find themselves into the sexual health field through another lens. Public health was the lens of which I found this field. And what I was doing is a lot of health education, particularly around prevention of STIs, and I was doing HIV post-test counseling. You know, a lot of people were coming in and they were having all kinds of anxiety and distress about the relationship, predominantly because the population I was working with was very concerned about contracting STIs, or a partner had, stepped outside of their relationship. And so they were concerned about, do I need to get tested and things like that. And, a whole host of other relationship concerns that I was not at all certified or taught in how to treat at the time. But I really became much more aware that, sexuality is so much more than what we do with our bodies. It's how we identify, it's who we're in relationship with, and there's so many more components to it that I really wanted to learn how to effectively help people with. And so that is really the shorter version of a much longer story that ended with a lot more academic schooling and training and all of that. So that's where my origin story began when it came to sexology.
Wonderful. And so what is the difference between, say, a sexual health expert and maybe even having a conversation with your OB-GYN at the, one time a year annual exam versus a certified sexologist?
Yeah.
Right.
Yeah, so I'll talk about it in terms of broadly. Sexology is the study of human sexuality, and it can refer to somebody who is a researcher, a practitioner, an educator. It's more of an umbrella term. A certified sex therapist like myself I'm both a sexologist and a therapist by training. So, if you might go see a therapist because maybe you and your partner are having a hard time connecting intimately and you're wanting some support, or you're experiencing changes in your libido or pelvic pain and that's affecting you sexually, and you're noticing that maybe you're having a hard time being present, you're experiencing more fears of intimacy, those psychological impacts are things that a sex therapist could help out with, or could help with the relational dynamics. Whereas like if you were to see a researcher, you might work with a researcher if you were looking for, what does the latest research study say about libido? How is this drug affecting women's libido, things like that. And an educator might work with someone if they're looking for maybe like some tips on how do we improve sex in our relationship, and more like quick tips or coaches, things like that.
Got it. Got it. Okay.
Yeah.
And
Now,
Nurse Kristy, you had some questions for
yeah, I
sure.
just had a quick question because you gave us a great rundown of the difference. Do you work with anyone in collaboration, or do you refer out?
Absolutely. So at Embrace Sexual Wellness, we are collaborative providers. We often work integratively with other people on the treatment team. That includes nurses. I think it's so important that everybody is engaged in the treatment team. And when we are all collaborating and working on our individual cases, I think that, tend to have better outcomes. So, a lot of people do come to us from their urologist, from their OB-GYN, from their psychiatrist, and they're working with a provider that they already really have a great relationship with. And if they don't have a provider and they're looking for one, we can absolutely refer somebody. But I think it's really, really important to cross collaborate, because we all have our lanes of genius, and we need to support our clients in that way.
Got it. Great. I appreciate the information and the explanation behind what is the difference. And so you talked a little bit about it already. If you're having like vulvodynia, which is pain for those who are not familiar, in particular pain with sexual contact, right, down below. That might be a reason to see someone like Dr. Litner. If someone is having challenges with sexual intimacy, physical intimacy, Dr. Litner, what are some of the things that you might actually recommend that they do to help mitigate that? Can you share a little?
Yeah, of course. So a couple of things: we want to understand exactly where the person's experiencing pain and what activities are causing that pain to emerge. For example, with vulvodynia or vestibulodynia, these are pain conditions that are on the vulva. Some people experience that with penetrative activities, but they don't experience that with non-penetrative activities. And if it's not something that's causing pain, there's really not a reason to stop doing it unless there's like a medical procedure that is going on or medication that could interfere with that. So we first want to understand that. And then once we have that information, then we might look at, okay, what if we just pause any activity that's causing pain for right now? Because that's only going to make the experience less desirable, right? We don't enjoy things that are painful unless that's part of your kink profile, but that's a whole different conversation.
Did you say kink profile?
Yes.
Oh,
yes.
Okay, so you have to tell us about what a kink profile is.
Right.
Yeah. So let's say we all have like a sexual menu, for lack of better words, right? Things that make us excited, that we're interested in. And a kink profile would just be like if somebody identifies as kinky, or they enjoy pain in a kink related behavior. That is different from I'm experiencing vulvodynia and it's painful and I don't want that to happen. So I always add a caveat that, pain is only okay when it's something that's consensual and part of your kink profile, as opposed to, a condition that we want to eradicate.
Got it. So when it comes to, one of the things that you mentioned in terms of getting into sexual health was working in public health, STIs, things of that nature. I know we have a mixture of people who listen in, some married, some single.
My mind, Nurse Kristy.
Okay, I was going to say, and I know you have a question, so I will punt it over to you to finish.
Okay.
I think we're on the same.
Absolutely, and let me know if this is what you were going to ask. But yes, we do have I would say a variety of age range that watch this podcast and listen. Any message for adolescents as far as providing education? Is this where you were going, Nurse Kristy?
It's not, but it's okay.
I thought I was reading your mind.
Happy to answer whatever questions come up, and if I don't know the answer, I'll let you know.
Perfect.
Yeah. So any, and do we call them patients or clients of yours?
I
How
call
do you
them
address?
clients, but I call them patients, but I'm talking to medical providers because that's the nomenclature in the medical system. So
Absolutely.
whatever you prefer makes sense.
That's
to me.
okay, because
That's what we're talking about.
I was thinking clients.
Yeah.
So what would be the age, or what is the most common age, youngest, I should say, age of an individual? And I'm assuming you see both men and women, or boys and girls.
Yeah. So in our practice clinically, we work with adults, so that would be 18 and up.
Okay.
That being said, for education purposes, we do events for teens and parents, and we also have some workshops that are designed for parents to use like tools with their kids, but we don't clinically at our practice see teens. However, there are a lot of practices that do. So, we've done a lot of consultation with folks around that. And I'm happy to speak to any questions related to adolescents. I just don't work with that population clinically. Yeah.
Okay. Nurse Kristy, go ahead, because I stole away your thought.
No,
I think.
Right. And I want to just say to those who are tuning in right now, please, if you have questions, this is the time to ask. You can always ask on behalf of a friend. If you don't want to ask, directly for yourself, but we have Dr. Litner here for a decent amount of time. So please put your comments in the chat there. But I wanted to ask, because you bring up a good point, Nurse Jessie, and I cannot see your face, so I can't read when you're wanting to delve in. So just interrupt me if you've got questions, because I only see Dr. Litner on my screen. But when it comes to younger people, right, boys or girls or those who haven't yet identified or choose not to identify a gender, how do you all go about talking with parents and even with the clients about body positivity and empowerment? We see so much on social media. I was just in the gym today, and I saw a young person, female, and she was like model thin, beautiful face. And then, of course, I'm looking like frumpy housewife. And then there's somebody else who's in the gym who's probably 20 years my junior, beautiful, but not this model-esque body type at all. And I see the energy between, I'm just looking, right? And I see each of them kind of checking each other out. So there's this thing of, I don't know what they were thinking, but in my mind, I only imagine is, wow, I don't look like that, from both of them, first and foremost. So this body positivity type thing. And then how does that play into one's sexuality?
Oh, those are such good questions. I'm so much to say on this. I think when it comes to the parents and caregivers conversation, we want to start that as soon as possible. So that's actually something that would start before somebody's even a teenager, in the sense that when you start to talk to children about bodies, there's a very, their children are sponges, they're going to absorb everything. It's important to talk about the different body parts we have and their function and how important they are, and not to, make somebody's body have a certain amount of worth, or tie their body to their body size, their body parts, how they're showing up, to their self-worth in a negative way. So it's really, like, a good example might be, we love your cheeks, we love your thighs, we love your body, drawing affirmation to these parts, but also, like, look how cool your arm is. It can hold up your heavy backpack on your way to school, or something like that. So there's ways to kind of initiate this early on. But certainly as kids are into adolescence, the big thing that they're observing now is all these messages on social media, all of, it's really ubiquitous. And there's so many people that are in the media that are often sort of a certain archetype, right? And I think it's really hard when a person doesn't feel like they fit, right? They don't see themselves represented. And this is true for people of size. I think, it's been true for, I think, people of color in a lot of ways, right? Like, we know that there's a lot of people who are non-binary, people who are trans, but you don't go to your, athleisure retailer, or wherever you're going to go buy your clothes, and see everybody that represents you. And that is problematic in its own way. So I think one of the ways that parents and caregivers can really talk with their teens is to actually, like, have conscious conversations about this. And, just because like to get them to think about, who do you think is responsible for bringing on the models, right, to try on these clothes, and where do you think
Right.
their ideas come from, right? And we are seeing it's almost 2024, and we are seeing a lot more companies having more diversity in their models. But the reality is that I think that the kind of there's a lot of body negative messages out there that people hold, and that's still like very deeply rooted. So there's still work we need to be doing about that, and making sure that we're having those conversations as early as possible, but also being thoughtful with youth about where do these messages come from, and what value they bring that's related to them, not just because of their body, but because of who they are.
Yeah.
And I think that instilling those kinds of values are really important.
Sure.
And yeah, I know you asked about the sexual piece, but I want to pause in case y'all have a thought or something there.
Yeah, I can appreciate that, and I think it's. I'm not a parent, but I can only imagine that it's not a one-time conversation either. Like you're having a regular reinforcement of how beautiful you are, how unique you are, and focusing on the things that make that child who they are, right? I don't know, Jessie. I know you have
Yes, and
daughters.
absolutely. And also it's constant reinforcement because of social media and because of your children's peers, like in school, and what they're talking about. They're talking about pop culture and the appearance of other girls, maybe in music videos, and how could they relate to those girls, and it's all fantasy. And I do remember when my girls were younger. My girls are adults now, but it's the constant reinforcement that you are beautiful, you are unique, you are your own person. And I remember my older one said, "You're just saying that because you're my mom." And right, but I can't even express how that hurt my feelings, because at an adolescent age or a teenager, they're just so vulnerable, right? And the outside influence is so heavy for them to relate or come close, and it's not reality. So that's very important. And I mean, you did speak about, Dr. Litner, how you're able to educate, the young adults. But have you had any challenges, especially when maybe a young adult, adolescent to young adult, may get themselves into trouble when they're coming for an STD or even HIV testing? What type of counseling or education? Because if someone is coming in for testing, maybe there's a concern there. I'm not saying all the time, but do you take that opportunity? Like, what do you do at that point? Because I don't want to speak for you.
Sure. Well, I think the one place this comes up quite a bit is actually we have an anonymous it's called Ask ESW. So it's a portal where people can ask questions. And it's come up in relationships too with patients. But I think, one thing that comes up a lot is people come in and they have questions about how they can contract an STI. Am I going to, contract an STI through kissing? And as if I have sex, but, we are having oral sex, what is the risk factor for, certain STIs? And I think that there's a lot of misinformation around that, particularly because, sex ed is a premium in the United States. It should not be. It should be something that, everyone has comprehensive sexuality education. But we know, even locally here in Chicago, I know that even though we have a great curriculum, not every school is effectively teaching it. And that's, we're one of the, I would say, more resourced cities around this area. So I think it's a challenge across the United States. We know a lot of people did not have accurate information. So getting accurate information is a big piece of the thing that happens, I think, with sexuality educators as well as therapists, helping fill in the gaps that people didn't have during adolescence and in early adulthood. And that can carry over, when it comes to them having their first intimate relationships too, feeling insecure or anxious about STIs, not knowing how to have conversations about, when was the last time you were tested? Hey, what kind of birth control are you planning to use? I would like to use this kind of contraceptive method. How does that feel for you? Having these kinds of conversations, adult conversations, important to have and be modeled, especially if people are being sexually active. And I think a lot of people don't have those tools because they weren't taught them. And that's a shame. So that's a lot of the work that I feel I end up doing. And then, it's also building on that around intimacy and talking about needs and assertiveness skills and the permission to explore your own body if you didn't feel like you had that. Maybe, working through any sexual shame that could be there. So there's a lot of different layers it can take on.
Yeah. And Jessie, I don't know if you have a question. Again, I can't see you, but okay. I was going to say, one of the things, Dr. Litner, I used to live in Chicago, so when I saw that, I was like, oh my gosh. I lived in the Northwest Burbs, so up Crystal Lake, Algonquin area.
Yeah.
But I remember doing some public health nursing at a center in Elgin, Illinois, actually, and it was an STD clinic, and having conversations with younger people. It wasn't necessarily older people. It was like early 20s, late teens. But now, when I'm talking to people, I feel like I tend to be talking more so to adults who are still single, right? And I don't know if you or if those out there listening are familiar with the term cuffing season. Like Beyonce had this song, and just cuffing season, for those who don't know, I think I know, and if I don't, somebody put it in the chat and correct me, but it's essentially like coupling up with somebody, right? Am I correct on that, Dr. Litner? Coupling up with somebody. So usually in the colder months, and we are in the middle of this, the end of December, going into January, I imagine that there are a lot of people who are coupled up. That being said, I always like to say, have conversations with your partners before you move forward in a physical, intimate relationship. And because I usually am talking to older people, I will say it's like buying a house. Get the inspection, ask for them to have a test, a panel ran, and share that with you, and look at their driver's license, because you want to make sure that that government name is the name on that report, so that they're not trying to run the okey doke on you and give you somebody else's report. I don't know. Am I being too, what are your thoughts? Am I being too rigid with that, or should people actually be doing things like that as adults, dating in today's world?
And to add to that, what are you seeing, Dr. Litner? Because as Nurse Kristy said, have a conversation, but we do know that not everyone is honest. So what do you see in your practice?
I think there's a lot of anxiety around having these kinds of conversations, and then also what is socially acceptable, and the lack of understanding about that. And people, like you mentioned, especially teens, really want to fit in. There's a lot of pressure there. And I think when people are dating, there's also a lot of pressure of wanting to be liked. People have a big fear of rejection. And when it comes to dating, you're putting yourself out there. It's also very vulnerable. And you want a positive response. You want to know that the other person's interested in you. And so I think there's a lot of fear around having a conversation around, I would call it transparency about STI status, but it's super, super important. So one of the things I love to recommend is, if you're seeing a new partner, why not just pop by the STI clinic, both get tested on, as part of your date. It's like, it doesn't mean that anything bad. It's just like gives you another layer of transparency and
assurance,
Yes. And if somebody has an STI, it's not a big deal, but you just need to think about, okay, so we're going to use dental dams, or we're always going to make sure we use condoms this way, or we're going to use an external condom and we're going to get flavored lubricant for oral sex because that's going to make it more fun and enjoyable. And we, can just make sure we're mitigating any risk. But it's really more about informed consent. You sign informed consent before you start with any healthcare provider. Well, if you're doing something with your bodies with your other partner, it's fair to be consenting to and informed about what it is that you're going to be doing, whether it be, STI status or any kind of behavioral act you're going to do?
So, Nurse Kristy, I just want to jump in because it's so important what Dr. Litner just said. And I just want to share my experience as a nurse at the bedside. And for the public that's viewing us right now, as a nurse, I have witnessed time and time again that you will have married couples, one couple will be in the hospital bed that just received their diagnoses of HIV positive, and the other partner does not know. And maybe that person, that individual in the bed is asking the medical staff, do not tell my partner. And I'm just putting that out there. I have witnessed this as in my white scrubs or whatever color scrubs that I'm wearing, wherever it is that I am working. If I'm working maybe the medical floor, I'm working overtime, this has come up. So public, listen. All right, Nurse Kristy, go ahead. I just wanted to just add that because it's out there.
No,
Nurse
I appreciate that story, and I have something very similar, and I'm sure, Dr. Litner, you have your thoughts on it, and I'll circle back. But you mentioned two things. One, the date at the clinic to get the test done together.
You know what? I love that.
Listen, I come up with a lot of wild stuff. Yeah, I'm right. I come up with a lot of wild stuff. That is not something that I've come up with, but I like it. I like it. We can go to the clinic and then go grab some appetizers.
Yeah, just add it on next to the restaurant. It's on the way, right?
I love that. But you also mentioned dental dam, and this is interesting. For those who don't know what a dental dam is, at least from what I recall, I was in the military and I actually specialized in dentistry. And so, yeah, so a dental dam is like a 6x6 piece of rubber, at least in dentistry. And it's used to isolate the tooth. But we also recommend that if you are not in a committed monogamous relationship, you're monogamous to them and they're monogamous to you, that you use a dental dam for oral sex to help prevent any sort of infections and or diseases, because herpes simplex 1 up here it's the same herpes, and it's herpes simplex V or virus down below. So if you've got something up here and you're doing whatever down below, it can transfer and then you end up with herpes. As an
vice
example,
versa.
and vice versa. Exactly. So what's down below can end up on your face. So that's number one. But secondly, I wanted to circle back regarding what Nurse Jessie said about being on the floor and speaking to someone. So in particular, herpes, I remember I actually was speaking with the physician, and then the spouse came out of the treatment room very upset, very disturbed, and wanting to know how did their spouse get herpes, because they've been married for 13, 14 plus years. And for those who may not know, and Dr. Litner, if you can go into some detail as well, but herpes is a virus, and viruses shed. And viruses, there can be things that trigger a virus in which you could have been living with it for years, and then now the virus is starting to shed and it's erupting and you're symptomatic. And I thought to myself, listening to this patient, how do you know you're not the one that gave the spouse the herpes, right? So can you share and just educate everybody who's listening in regards to viruses, but herpes in particular, and why that is such a special kind of virus?
Well, I think people have a lot of stigma and fear around herpes because it's something that it's a virus. It doesn't necessarily go away forever, right? And so the idea of anything being forever is scary for people. But the reality is that a lot of people living with herpes don't experience an active presentations of it, because it's something that can be dormant and then show up at different times. So it can be very well managed. And there are also certain medications, antivirals, that folks can take if they are in partnerships with someone who has herpes. So it's really, it's by no means something that we need to, have a freak out about. But a lot of people, I think, assume if their partner has herpes that or any STI, that means they had cheated on them or were unfaithful or
Right.
some type of relationship. And so that by all means could be the case, but it's also possible that somebody had herpes and they wouldn't know, or they thought that it presented more like a cold sore type thing and they didn't know. And also, like, testing isn't always accurate for that kind of thing. So this is why there's a 3-month window period for testing, and you should go to the STI clinic, talk to your PCP about that, just to be really informed, especially if you are having, new partners or more active sexual life with multiple partners. So I think that that's just something important to know. And by all means, we don't need to be, super concerned and assume the worst. You just need to know, do we have it? And if we notice anything different on our bodies, like, what is our responsibility to inform partners, and what kinds of things do we need to do to help make sure that we can have a fulfilling experience, but that everyone's informed about what risks potentially are. Because there are partners who have herpes that they're, having sex with one another and they're never going to pass it if they're not, it's very unlikely that they would pass it if they're not symptomatic. And then there are other times when they are symptomatic and it's more likely. So, just being informed about the risks and what's going on for you with your provider, so that you can then talk to partners, I think is really important. And if you're ever having a hard time with feeling, maybe you feel anxious, or there's a lot of stigma that you're carrying around this, talking to a sexual health professional can be really useful, whether it be a therapist or a coach or educator, because we deal with this kind of thing all the time.
And is that something that your company is able to support, Embrace Wellness, to help kind of come up with sound bites to have conversations with someone that you're starting to move a little bit closer to and maybe want to begin a monogamous relationship?
Yeah, absolutely. I think, one of the things that I'm going to call this like internalized stigma, because I think a lot of people have internalized stigma about different things. The way that even some people sex ed used to talk about STIs was like, you're a used piece of gum or something like that. And that's like such a terrible shaming thing that is not true. So we will often work with clients around what is their history about STIs, what did they learn about it, what are they feeling now, and how do they approach conversations with partners. So yes, if they're having any kind of anxiety about or discomfort around dating, whether it be because of an STI or because of anything else in their history, those are absolutely things that we help clients with in our practice.
Love that. Nurse Jessie?
Yes. I was actually going to change gears and just talk about your experience with maybe clients experiencing sexual dysfunction due to maybe cancer, or women with gynecologic cancer, or maybe the male with prostate cancer, and whatever treatment ensued based on that cancer. Are you treating clients with any of the above that I said?
Yeah, absolutely. So one of the things we know is that when someone experiences cancer, often in cancer treatment, particularly a person who is assigned female at birth, they might experience more vaginal dryness. Their tissues may experience, they may go through early menopause if it's premenopausal when they're experiencing this, and that can cause all kinds of sexual pain and discomfort. And so this is a very common response to cancer treatment, but it's not very commonly talked about by the medical team, because their job is to keep their patients alive, right? And so that becomes more of the priority. And sometimes and I'm only saying this based on what our clients tend to report and what the research says. I mean, I like to think, and I hope that a lot more providers are having these conversations now, but sometimes the sexual symptoms and what can happen after is just not a huge priority for the medical care team. And, there's only so much time you'll have with patients and things like that. So one of the ways that we will work with clients around this is if they're having challenges approaching intimacy afterwards, right? Like maybe they're trying to figure out how did they and their partner reconnect? How do they appreciate their body again? What if their body's experiencing they're experiencing dryness and nothing feels good in their body? We might recommend that they seek out either urogynecologist or work with their pelvic health physical therapist. We can also recommend certain types of moisturizers, serums. There are also like prescription ones that can help with repairing the vaginal tissue so that they can experience more of a lubricated sensation as opposed to an itchy or burning or dry one, which of course would cause discomfort. So there are some topical solutions that can be really useful. There's also a sexual medicine center locally in Chicago that we like to work with. So there's definitely avenues around this on the physical side of things, and then the emotional and psychological things and relational. We're also talking about what it means for them to be intimate again, because a lot of people might have a very different relationship to their body after cancer, and their partner too. So being able to really talk through that and have maybe have another a sexuality 2.0 or a different sexual relationship, and kind of rediscovering that is something that we help people with.
Yeah, I did appreciate that. Nurse Kristy, you look like you had a question.
No, I actually was going to speak about you. So, Nurse Jessie is actually wrapping up her doctoral studies, and I know I love to just share with everybody. I'm so proud. I'm so proud of you. I'm looking at you. Well, I'm not looking at you, but I'm I'm so proud of you. But your studies, Nurse Jessie, are actually in sexual intimacy after oncologic treatment, right? So I'm curious in regards to some of what Dr. Litner had mentioned, sort of like this sexual intimacy, this kind of refreshing of sexuality 2.0. How does what Dr. Litner shared fit into some of the people that you've interviewed, right? And what sort of stories have they shared with you regarding their intimacy post-treatment?
Well, Dr. Litner is right on, based on the research and the participants that I have spoken to. And first of all, it is a journey. They have to pretty much rediscover who they are, because the person who they were is no longer there. Right. And now they have to get to know who they are now and moving forward. I've also noticed through the literature as well as interviews that it's a continuous process. And maybe because the participants are from young up until maybe age 70 that I've interviewed. And even from the 70-year-old, it's still a continuous process. I'm still discovering myself, and maybe gynecologic cancer treatment was, I don't know, over 10 years ago, if it was surgery, whatever it is. But what was really resounding and just coming out of the interviews is exactly the point where the participants were not having conversations about sexuality. They were in shock and were not prepared of what was to come. Mm-hmm. No one prepared them to say, for the premenopausal woman, that you will be in menopause or you will experience abrupt menopause. Here are some of the symptoms. And they really were upset that maybe if they would have known, maybe they would have gone to a certified sex therapist to learn what they can do to ease those symptoms. So that's very important. And that's why I asked the question, do you have a clientele of, patients with cancer or suffering from cancer? And, out of curiosity, how many of these patients or clients do you see? Because yes, sexuality, especially women's sexuality, it's almost as if we're not allowed to talk about it. That's bull. It's part of health, well-being. And this is exactly why I chose this topic for my dissertation. It's like, what is wrong with women's sexuality? Like, it's almost as if we're not allowed to talk about it. Do you feel that way, Dr. Litner? Or obviously maybe you don't feel that way, but maybe out there in the community, like, what are they saying? And is it almost like a taboo topic?
Yeah, I think, well, first of all, huge
Thank
congratulations.
you.
I want to amplify your work. That's amazing. And I'm so excited for you.
Thank you.
We need to give a moment to that, to your research. Yay! I think that by not having conversations about helping patients and clients know what to expect with their bodies, whether it be, something that's going to happen in a medical setting or anywhere else, like, I think that is not only doing patients a disservice, but it's also silence, right? So we're not giving a moment to something that's really important and could be really impacting that person's life, but also their partner's life. And I think that that's something that is maybe just, again, not top priority when we talk about oncology, because, the main purpose is, let's get rid of the cancer, let's make sure the person's living and healthy, but we don't think about vitality in that moment, right? And sexual intimacy is often quite a bit about vitality for a lot of people, and maybe their needs change over time, because of course sexuality evolves and as our life goes, as we go through life, but it deserves a space in the conversation, just like your nutrition, just like, your aesthetics, like your hair loss, right? And making, if that's going to happen, right? Just like everything else that is important when it comes to survivorship. So I think that is definitely a problem that I've seen among the patients that I've worked with around this.
And hopefully, my dissertation, as well as others, will just shed some light that we really need to begin normalizing this conversation. Because as of now, where it stands, it's not a normal conversation. As the nurse, oncology nurse, again, within clinical practice, I had an oncologist that told me that we are focusing on the cancer. Like almost like, don't you dare ask me about sexuality. Like, what do I know with that? Like, what am I supposed to do with that?
It's like if you were to go get a flu shot, they're going to tell you the possible risk factors and side effects of that flu shot, right? Your arm might be sore, you might develop fever or chills, right? There could be other things too. If you are going through cancer treatment, you deserve to know the impact that that's going to have on your body and the potential impact that could have on your other parts of your well-being. So I really hope your research can lead to, maybe some wonder. I see a grand rounds in your future for the medical team, and hopefully people can really start to learn this, because it's important. And I think patients want to know it. Maybe it's not something that they're thinking about in the moment when you're bringing up this conversation.
Sure.
But, I bet your bottom dollar that, a year from now, they're going to be thinking about it when they're trying to have sexy time and it doesn't feel so good, and then they'll get lost. So we don't want that for people.
Absolutely. And when they are ready, oops, if I would have known, I should have done that to prevent this, and there's so many, I won't even get into, but there's just so many different side effects depending on the treatment.
Right.
But that's a lot of what I heard. If I would have known what I know now, I would not have had another surgery to, repair whatever it is. So absolutely. And when we talk about sexual empowerment and we spoke about body positivity, again, it does fall within the same realm to discuss the importance, just for empowerment for these patients. And you did touch on how to increase self-esteem and embracing our bodies. And I just totally forgot where I'm going with this, but I totally forgot where I was going with this. But just thinking about the clients that come into your, clinical practice or your practice, what natural, if you are aware of any natural remedies, maybe to maintain vitality, Is there anything that exists? Do you know of anything? I've heard a lot about maybe vitamin E. And this is just, of course, I'm not saying that this is scientifically proven, but just asking Dr. Litner, have you heard of anything natural to repair, maybe vaginal tissue, or just to keep it moist, rejuvenated? I also heard coconut oil and vitamin E. So I'm just stopping there. And have you heard of anything, or do you know of anything natural?
Yeah, so it's really important to make sure there's going to be very few irritants on whatever ingredient list you're putting on the vulva, particularly because, there are things that have like glycerin, which is, in a lot of moisturizers, or other things, parabens, other ingredients that might have fragrances, alcohols. That can very much irritate the tissue and cause, more harm than good, and kind of make it even more difficult to treat the issue. So definitely wanting to have more natural things. A lot of the products that I tend to recommend are, there's one through like Reverie makes some, as well as Kindred, I think, has some, but they have hyaluronic acid in it, which is a compound that's in a lot of skincare products and helps with rejuvenation of the tissues. It's a totally natural product, and it doesn't interfere or have any kind of estrogens in it. So for somebody who has a history of breast cancer or other cancers, that would be an issue for, it doesn't interfere with that. And also I have heard good things about vitamin E. I mean, coconut oil could be okay, but also it can cause clogged pores and things like that.
Heavy.
So I don't generally.
Right.
It's heavy, yeah. So I generally wouldn't recommend that offhand unless you didn't have anything else. But I would stick to some of these science-backed brands. Like I think Reverie makes some good products for like serums and moisturizers. There's also like vaginal moisturizers. I think Good Clean Love makes some. Slippery Stuff makes a lubricant. I think they also make a moisturizer, but I have to look. So there are a number. I would just make sure that when you're reading that the product has, you understand everything that's in that product, and there's nothing in there that could be irritating. And try it out on your hand or your arm or somewhere that's not your vulva. Make sure you don't have a reaction to it before you put it down there, because nobody wants to experience that. It's going to be uncomfortable when they're already experiencing discomfort. We want to make sure it's like the
No itching down there.
No.
Well, listen, I first, again, want to thank you, Dr. Litner. I know we're coming up on time. I want to thank everybody who has tuned in actively to listen to this conversation. You can find, Dr. Litner, you can tell everybody where to find you.
Okay. You can find us at Embrace Sexual Wellness on Instagram, or embracesexualwellness.com is our website. And we have a ton of resources there. So books, other podcasts, and really great videos and resources, as well as our blog. There is a blog about cuffing season. I know you mentioned that. So we are kind of in cuffing season right now. So if something is curious to you, head over to our blog.
I love it.
So
well,
funny.
And go ahead, Jessie.
I was just going to say, yes, you're in Chicago, so it's cold. I'm here in Miami. It's not cold. I don't know if we're in cuffing season or not. I mean, cold for the Floridians would be like 50 degrees. To me, it's refreshing.
Right.
That's not cold, because I'm a New Yorker. Really, I'm born and bred from New York. So I'm never cold here in South Florida, but I'm just thinking, okay, so if it's cuffing season for like Chicago and where you are, what about Miami? Is it cuffing season?
It's cuffing season for Floridians too.
Yes.
It is still that season. But if you have questions, or certainly, and correct me if I'm wrong, Dr. Litner, you all are able to do virtual consultations as well, right?
Yeah, so a number of our providers, we're all licensed in Illinois. A number of our providers are licensed in a couple other states as well. So we do work with folks via telehealth or video counseling. So if you are not able to, get to our office in Chicago, and you live in one of the states where we're licensed, we can absolutely support you. And if you're out of those states, we'll get you connected with another provider that we trust in those in that area. So feel free to reach out. And we do educational programs globally, and so that there's no licensure restriction there.
Wonderful. And one of the last things that we love to do here
Yes.
at Stirrup Sisters Podcast is we like to do a round robin of rapid fire questions. We've got 5 questions. You can't think too long on them.
Okay.
So, Nurse Jessie, do you have your questions pulled up?
I don't have them up.
No, it's okay because I do. So,
Good.
Number 1, guilty pleasure TV show or book?
Ooh. I'm watching the what is it called? The First Wives Club right now. So I'm kind of interested in that.
Yes. I love that show. Number 2, life motto or mantra?
I think I really life motto or mantra. I think it's like, you're crushing it. Like I feel like every time that I'm like feeling like I'm overwhelmed with something or I'm not sure if I'm like doing a great job, I just like remind myself that I'm crushing it, even if I'm not. And
Okay.
I think that makes it better.
That.
Yeah.
I like it too. A little hype yourself up. I'm not mad at that.
Internal, like, hype show.
Yes. Dream travel destination.
Ooh, I love to travel. I've always wanted to go to Malta, which is off the coast of Italy. You've been to Malta?
Yes.
Oh, wow.
Very nice. Very nice.
Wonderful. Favorite comfort food?
Ooh, I'm gonna say grilled cheese and tomato soup.
Yummy.
Okay, love that. Probably not grilled cheese so much anymore, but the good tomato basil, like the grown-up version, right?
The grown-up version.
Not Campbell's. I'm not into the Campbell's.
No, it has to be like well made and
fresh. Yes, crush the tomatoes into the soup. Yeah.
Love that. I'm trying to watch carbs. That's the only reason for the mixing on the grilled cheese. But
tomato soup.
And then last question.
Go ahead.
If you had a superpower, what would be your superpower?
Oh, I think to eradicate shame.
Oh.
Eradicate shame.
Yes.
I love it. Well, thank you so much for everyone who is listening and for those who will watch later. You can find Dr. Litner at Embrace Wellness on Instagram.
Mm-hmm.
And what are your other Instagram as well as Facebook?
We're on Facebook too, and our website, embracesexualwellness.com.
EmbraceSexualWellness.com. And it's at Embrace Sexual Wellness.
I know it's a mouthful. We often call it ESW just for short, but
I love that, ESW. And if you're in the Chicagoland area, definitely you can look them up as well. Thank you so much, Dr. Litner. It has been a pleasure. And for all of you all watching, thank you as well. And hope you all learned a lot. We'll see you again in 2 weeks.
Thank you.
Thank you so much.
Litner. Happy New Year.